According to recent studies, over 21 million adults and 3.7 million children in the United States suffer from depression, and those numbers have been on the rise over the past several years. When someone who is suffering from depression goes to see a doctor, they will typically prescribe an antidepressant. But as we shall see, there is a large variety of potential antidepressants, and when it comes to picking the right one size does not fit all. According to a study conducted in 2016, 44% of patients discontinued their prescribed antidepressant within 3 months. Side effects are one of the main reasons people with depression stop taking their antidepressants. Another reason patients report discontinuing their antidepressants is because they do not notice any improvement. For antidepressants to be given a chance to be considered effective, they need to be tried at an adequate dose and duration. All antidepressants have clinically effective doses, which are the recommended doses for said medication to be effective. The clinically effective dose for a medication is often referred to as the therapeutic dose. If a patient doesn't get up to the therapeutic dose, it may not be considered a failed trial. As far as adequate duration, international guidelines recommend a duration of 4 to 12 weeks for an initial antidepressant trial at an optimized dose to get a response. If depressive symptoms persist after this duration, guidelines recommend upping the dosage, switching meds, augmenting with another med, or combining strategies as the next step. There are multiple classes of antidepressants, each of which works in a different way, and each medication within those classes comes in various doses. Finding the right med in the right class at the right dose can take some people years. The most common antidepressant classes include SSRIs, SNRIs, MAOI, and TCAs. The most prescribed class of antidepressants are the SSRIs. SSRI stands for Selective Serotonin Reuptake Inhibitor. As the name suggests, this class works by inhibiting, or in other words, slowing down, the brain's ability to reuptake the neurotransmitter serotonin, which causes the levels of serotonin in the brain to be higher. Serotonin is commonly known as the happy chemical because it plays a major role in mood regulation. When someone has healthy levels of serotonin, they tend to be more focused, emotionally stable, confident, and generally happier than people with lower levels of serotonin. Because serotonin is so closely associated with depression, this class of drug is often the first line of defense against depression. Let's look at the individual drugs within this class. The most prescribed antidepressant in the SSRI class is escitalopram, which is generic for Lexapro. Like most antidepressants, Lexapro can cause a multitude of side effects, such as weight gain, headache, GI issues, anxiety, insomnia, and it is notorious for lowering the sex drive. Because of these side effects, most doctors will start off a patient at a very low dose, around 5 milligrams, and then have them increase to 10 milligrams after a week or two. After the first month, the patient will usually do a follow-up and the doctor will determine if the medicine is working. If the Lexapro is not working and the patient is still depressed, then they will raise the dose to 20 milligrams, which is considered a clinically effective dose. Once again, all antidepressants have clinically effective doses, which are the recommended doses for that particular medication to be effective. After being on 20 milligrams of Lexapro, if the patient is still reporting depression, the doctor may raise it to an even higher dose or opt to discontinue the medication. Doctors will rarely prescribe more than 30 milligrams of Lexapro. Another common outcome of these antidepressant trials is that it can cause severe side effects, in which case they will discontinue them immediately and prescribe something new. The second most common SSRI that is prescribed is sertraline, which is generic for Zoloft. The common side effects of Zoloft are very similar to the Lexapro, and Zoloft is also started at a low dose and gradually raised up to a clinically effective dose. Patients may start as low as 25 milligrams on Zoloft and slowly get up to 150 milligrams, which is the clinically effective dose. Doctors will rarely prescribe over 200 milligrams of Zoloft. Another extremely common SSRI is fluoxetine, which is generic for Prozac. Prozac was the very first SSRI to be released in the United States back in 1988. Prozac has all the traditional SSRI side effects, so the doctors may start as low as 10 milligrams and gradually work their way up to 40 milligrams, which is the clinically effective dose. 80 milligrams is about as high as doctors will normally go on Prozac. Paroxetine, which is generic for Paxil, is the strongest SSRI available, which means that it has the strongest inhibitory effect on the reuptake of serotonin. With this increase in strength comes an increase in side effects. Paxil had one of the highest discontinuation rates because of the side effects during its clinical trial. The lowest dose is 10 milligrams, and the clinically effective dose is 40 milligrams, with the limit being around 60. Citalopram, which is generic for Celexa, is very similar in structure to Lexapro. Celexa was released in 1998, and 4 years later its structure was altered and released as Lexapro. Celexa may start at 10 to 20 milligrams, and the clinically effective dose is 40 milligrams. Less common than the others previously mentioned, fluvoxamine, which is generic for Luvox, is also a strong SSRI that is notorious for its side effects. Low doses of Luvox are 25 to 50 milligrams, and 100 milligrams is clinically effective and may go as high as 150 milligrams. One of the newer SSRIs on the market is vortioxetine, which is more commonly known as its brand name, Trintellix. Although Trintellix has a great reputation for being extremely effective, for many people it is out of their price range. Because it is a newer drug, it is not available in its generic form, which forces people to pay top dollar for the name brand. The starting dose for Trintellix is 5 milligrams, and clinically effective dose is 10 milligrams, but may go as high as 20 milligrams. And lastly, we have another newer medication called vilazodone, which is generic for Viibryd. Viibryd works a little bit differently than the other SSRIs because it not only inhibits the reuptake of serotonin, but it also enhances a specific type of serotonin receptor, which adds to the increase in levels of serotonin. Starting dose is 10 milligrams, clinically effective is 20, and it can go as high as 40 milligrams. After someone has tried a couple of SSRIs and still have not gotten better, doctors will usually start to explore different classes of drug. Nowadays, one of the most common classes doctors will try after giving up on the SSRIs is a class known as SNRI. SNRI stands for serotonin norepinephrine reuptake inhibitor. So, just like the SSRIs, SNRIs inhibit the reuptake of serotonin, but they also inhibit the reuptake of norepinephrine. Norepinephrine is another neurotransmitter that is associated with the production of adrenaline. Anyone who has ridden a roller coaster has experienced what is known as an adrenaline rush. Adrenaline causes the body to become more alert and can increase blood pressure and heart rate. It can also cause a boost in energy levels, which is what happens when we experience a flight or fight response. Because of the way norepinephrine affects the body, it makes SNRIs a particularly good choice for people who are experiencing low levels of energy and motivation that are common with depression. Because SNRIs are raising levels of both neurotransmitters, they can often be more effective than SSRIs. However, they are much harder for the body to tolerate, and they are extremely hard to get off of. The SNRIs cause almost all the same side effects as the SSRIs, but the side effects of anxiety and insomnia are usually much more pronounced because of the norepinephrine, and in some cases can even cause tremors. One of the most prescribed SNRIs is duloxetine, which is generic for Cymbalta. Cymbalta was originally released to treat depression, but was also FDA approved to treat neuropathic pain in diabetics and can also be used off-label to treat other types of nerve pain as well. Cymbalta has a well-balanced effect on both serotonin and norepinephrine. Starting doses of Cymbalta are usually around 20 milligrams, and clinically effective dose is 60 milligrams. Cymbalta can go as high as 120 milligrams. The very first SNRI to hit the market back in 1993 was venlafaxine, which is generic for Effexor, and it is still one of the most commonly prescribed SNRIs on the market. Unlike Cymbalta, Effexor has a stronger effect on serotonin than it does the norepinephrine, which makes it a better option for patients who are sensitive to anxiety-related side effects caused by this class of drug. Out of all the SNRIs, Effexor takes the longest to get to clinically effective doses. Because of the severe side effects that people experience when beginning this medication, doctors will usually start someone at 37.5 milligrams and will gradually raise them up several times to get to the clinically effective dose of 225 milligrams. Doctors will only rarely prescribe above the clinically effective dose. Desvenlafaxine, which is generic for Pristiq, is another common SNRI. As the generic name suggests, desvenlafaxine is very similar to venlafaxine. Unlike the previously mentioned SNRIs, Pristiq is not FDA approved as a treatment for anxiety. Pristiq is generally considered to be more tolerable than Effexor. However, one downfall is that it is much more expensive. Pristiq can also be used off-label to treat hot flashes in women going through menopause. The starting dose of Pristiq is 25 milligrams, and the dose will usually be raised several times to get to the clinically effective dose of 100 milligrams. Pristiq can go as high as 400 milligrams. Finally, we have the newest of all the SNRIs, Fetzima. Fetzima's generic name is levomilinazepam. However, currently there is no generic version of the drug available, which makes it very expensive. Fetzima is only FDA approved to treat depression, although its chemical structure is very similar to some drugs that are used in the treatment of fibromyalgia and will sometimes be prescribed off-label to help with pain caused by fibromyalgia. Fetzima has a stronger effect on norepinephrine than serotonin. The starting dose for Fetzima is 20 milligrams and clinically effective dose is 80 milligrams and can go as high as 120 milligrams. The next class of antidepressants are the tricyclic antidepressants, also known as TCAs. TCAs are much older than the SSRIs, which hit the market in 1988, and the SNRIs, which came out in 1993. The very first TCA to get FDA approval was imipramine, which is generic for tofranil. Tofranil was released in 1959, and the doses range from 10 milligrams to 50 milligrams. TCAs are rarely used as a first line of defense in treating depression, and most doctors will not resort to using them unless the patient has already failed to respond to multiple trials of other classes of drug. This hesitancy is because there are some increased risk factors with this class of drug. First of which is TCAs are very toxic at certain doses, which means overdose on this medication can be fatal. The therapeutic window in which doctors must prescribe is very narrow, thus making it extremely easy for accidental overdoses to happen, and there have even been reports of overdose caused by a single tablet. The side effects caused by TCAs also tend to be more severe, such as dry mouth, blurry vision, constipation, urinary problems, drowsiness, weight gain, and excessive sweating. TCAs are similar to SNRIs in the sense that they inhibit the uptake of serotonin and norepinephrine. However, unlike the SSRIs and the SNRIs, TCAs are not selective in which receptors they are inhibiting. This means that the inhibition is widespread and affects all the receptors, regardless if they are a component of mood regulation or not. This in turn is what leads to the increased side effects with this class. There are many individual drugs within the TCA class, but there are only a few that are still commonly prescribed, and many of them are used off-label to treat conditions other than depression. One of the most common TCAs that are still prescribed is amitriptyline, which is generic for Elavil. Most people will take Elavil at night before bed because it tends to make people drowsy and can be used off-label to help people who are suffering from insomnia sleep better at night. It can also be used off-label to treat chronic pain conditions and migraines. The doses range from 10 milligrams to 150 milligrams. Amoxapine, which is generic for Ascendin, is also still prescribed on occasion and, like Elavil, can be used off-label to help with insomnia and neuropathic pain. The doses range from 50 milligrams to 150 milligrams. Desipramine, which is generic for Norepinephrine, is another TCA that has a variety of off-label uses, including the treatment of bulimia, irritable bowel syndrome, neuropathic pain, overactive bladder, to treat some of the symptoms of shingles and ADHD. The doses range from 10 milligrams to 300 milligrams. Doxepin, which is generic for Sinequan, is meant to treat depression and anxiety at high doses, but it is also extremely common as a sleep aid when prescribed at low doses. Doses range from 10 milligrams to 100 milligrams. And finally, another TCA that is very similar to amitriptyline is nortriptyline, which is generic for Pamelor. Nortriptyline also has off-label use for chronic pain and can sometimes be used as an aid to quit smoking. Doses range from 10 milligrams to 75 milligrams. The next class of antidepressants are the oldest of all the classes. Monoamine oxidase inhibitors, or MAOIs for short, were originally released for the treatment of tuberculosis in the early 1950s. In 1952, researchers accidentally discovered that these medications were helping with the tuberculosis patient's depression, thus creating the world's first antidepressant medication. MAOIs work by inhibiting monoamine oxidase enzymes, which assist in the breakdown of certain foods that contain monoamines, a substance that the body uses to make neurotransmitters. These enzymes also inactivate the monoamine neurotransmitters within the brain, which is why the MAOI inhibitor can help with psychiatric issues. Monoamine neurotransmitters include dopamine, serotonin, and norepinephrine. When an MAOI inhibits the body's ability to use monoamine oxidase enzymes, it prevents them from deactivating all of the monoamine neurotransmitters in the brain, thus causing them to last longer and increase in level. This means that MAOIs are not selective. They cause an increase in all the neurotransmitters. MAOIs can be used in the treatment of many psychiatric illnesses, including depression, panic disorder, agoraphobia, PTSD, bulimia, borderline personality disorder, OCD, and bipolar disorder. Much like TCAs, MAOIs are rarely prescribed today, and when they are, it's done with extreme caution. The most notable issue with MAOIs are the dietary restrictions that are necessary while taking this class of drug. Any food or drinks that contain high levels of the amino acid tyramine can cause a potentially fatal reaction while on an MAOI. Some of the restricted items include cheese, soy sauce, salami, certain wines, and pickled fish. If too much tyramine is ingested, it could cause the brain to release too much norepinephrine. Normally, the MAOs would destroy the excess norepinephrine, but if they are inhibited, that rise in levels will go unchecked and could potentially lead to a fatal hypertensive crisis. There is also a risk of drug interactions with certain prescription and over-the-counter meds, as well as some dietary supplements. These drug interactions can lead to the brain producing too much serotonin, with no way of getting rid of these excess levels, which can cause serotonin syndrome, which is potentially fatal. Some MAOIs include MSAM, which is a transdermal patch that delivers the generic drug selgaline slowly over a 24-hour period. Doses range from 6 to 12 milligrams. Isocarboxazid, which is generic for Marplan. Marplan comes in a 10 milligram dose that is taken twice a day and can be gradually raised up to a maximum of 60 milligrams a day. Phenelzine, which is generic for Nardil, comes in a 15 milligram tablet that needs to be taken every 8 hours, which can be doubled for a maximum dose of 90 milligrams a day. And lastly, we have tranylcypromine, which is generic for Parnate. Parnate is also taken every 8 hours with a maximum daily dose of 90 milligrams. The last group of antidepressants are all in a class of their own. Atypical antidepressants are unique in their mechanism of action, which means they don't fit into any of the previous classes mentioned. Just because they are atypical does not mean that they are uncommon. As a matter of fact, some of the atypical antidepressants are amongst the most prescribed antidepressants today. One of the most common atypical antidepressants is bupropion, which is generic for Wellbutrin. Wellbutrin is a norepinephrine and dopamine reuptake inhibitor, or NDRI for short. Wellbutrin is the only antidepressant that selectively inhibits the reuptake of dopamine, a neurotransmitter that is associated with pleasure and reward. One of the most notable benefits of Wellbutrin is its lack of sexual side effects that makes it a very common choice for younger patients that would be most affected by some of the sexual side effects that are so common amongst other classes. Common side effects include GI issues, anxiety, insomnia, and agitation. Wellbutrin comes in two forms, standard release or SR and extended release or XL. Wellbutrin SR comes in 100, 150, and 200 milligram tabs and can be taken up to 2 to 3 times a day. Wellbutrin XL comes in 150 milligram or 300 milligram tabs and is only taken once a day. The clinically effective dose is 300 milligrams, with the highest dose being 450 milligrams. When Wellbutrin is taken in high doses, like 450 milligrams or higher, it can lower the seizure threshold. So these higher doses are not that common, as there is an increased risk of seizure. Another extremely common atypical antidepressant is mirtazapine, which is generic for Remeron. Remeron is a tetracyclic antidepressant, which means it is very similar to the TCAs, which are tricyclics. Remeron is usually prescribed in low doses to help people sleep because of its sedating side effects. A starting dose of Remeron would be 7.5 milligrams, with 30 milligrams being the clinically effective dose and 45 milligrams being the max. Remeron is rarely used as a first line of defense to treat depression because it tends to have more severe side effects than some of the other classes and it is notorious for weight gain. Like the TCAs, the therapeutic window is very narrow, which makes accidental overdoses very easy, which is why it is rarely prescribed as a first line of defense. The last common atypical antidepressant is trazodone. Trazodone is a serotonin antagonist and reuptake inhibitor, or SARI for short. SARIs are very similar to SSRIs as they both bind the receptors that reuptake serotonin to make it last longer when released in the brain. But SARIs have the added effect of also causing the brain to produce more serotonin as well. Trazodone is mostly prescribed in low doses to help people sleep, usually around 50 to 150 milligrams. Trazodone can also be used in higher doses to treat depression, with the clinically effective dose being 300 milligrams and the maximum dose being 600 milligrams. Trazodone has the same side effects as the SSRIs. If a patient is on an antidepressant that they are tolerating well, but it's not making enough of an improvement in their symptoms, the doctor may try to add on an augmentation agent to increase the effectiveness of the antidepressant. There are multiple augmentation strategies that can be used that involve several different classes of drugs. One augmentation strategy is to prescribe 2 antidepressants simultaneously. The antidepressant that is added on as an augment will usually be in a different class than the primary antidepressant. One example of an antidepressant that is commonly prescribed as augmentation is Wellbutrin. One of the most common augmentation strategies that doctors use is the addition of a second-generation atypical antipsychotic, many of which are FDA approved in the treatment of major depressive disorder. Just like the antidepressants, atypical antipsychotics also have several side effects, with the most common being sedation and weight gain. One of the most common drugs in this class is aripiprazole, which is generic for Abilify. Abilify has a wide range of doses, with the lowest being 2 mg and the highest being 30 mg. It is important to note that when atypical antipsychotics are added on to augment an antidepressant, it is usually in lower doses, whereas higher doses are more indicative of bipolar disorder and psychotic symptoms. Another common atypical antipsychotic that is prescribed as an augment is quetiapine, which is generic for Seroquel. Seroquel has a wide range of doses, but the FDA has specifically approved the 150 mg extended release as an augmentation for major depressive disorder. Seroquel causes sedation, so it is commonly used in lower doses to help people sleep, and in higher doses it can help treat bipolar and psychotic symptoms. Seroquel is notorious for causing weight gain. Another atypical antipsychotic that is FDA approved for the treatment of depression is Rexulti. Doses for Rexulti range from 0.25 mg to 4 mg. Although Rexulti is very effective as an augmentation agent, it is not available as a generic, which makes it expensive. Symbyax is another drug that has been FDA approved for depression. Symbyax is a combination of olanzapine, which is generic for Zyprexa, and fluoxetine, which is generic for Prozac. Both Zyprexa on its own and Symbyax are usually taken at night because of the sedative effect, and it is particularly notorious for causing major weight gain and the health-related issues that come with it. Clinically effective dose is 6 mg of olanzapine with 25 mg of fluoxetine. A newer drug that is not available in a generic form called Vraylar was also recently approved in 2022 as augmentation for depression. Vraylar doses range from 1.5 mg to 6 mg. Risperidone, which is generic for Risperdal, and Zyprazidone, which is generic for Geodon, are often used off-label as augmentation for depression. Another strategy that can be used for augmentation is the addition of a mood stabilizer. Mood stabilizers are typically used in the treatment of bipolar disorder, but certain mood stabilizers can be helpful in treating depression. Although a couple different mood stabilizers may be used for augmentation, lithium is the only one that has FDA approval as an augmenting agent for depression. Lithium doses range from 300 mg to 1200 mg a day, although the higher doses are more indicative of bipolar disorder. Lithium is not prescribed as commonly today because it can be toxic to the thyroid and the kidneys, and patients that are on lithium need to have regular blood work to monitor the levels of lithium in their blood to ensure that they are not at toxic levels. There are many other mood stabilizers that can also double as anticonvulsants. These include lamotrigine, which is generic for Lamictal, valproate, which is generic for Depakote, oxcarbazepine, which is generic for Triliptal, carbamazepine, which is generic for Tegretol, and topramate, which is generic for Topamax. Of all these drugs, the only one that is commonly used off-label to help with depression is Lamictal, which many doctors are opting for over lithium because it does not need the routine blood work that lithium requires. Lamictal doses range from 25 mg to 300 mg. Anxiolytics are medications that are used to treat anxiety. The most common type of anxiolytic are the benzodiazepines. Because so many people who have depression also suffer from anxiety, it is very common for patients to have an anxiolytic in their regimen. Benzodiazepines, commonly referred to as benzos, are depressants that produce sedation and hypnosis, which helps relieve anxiety symptoms. Benzos have a high potential for abuse and are controlled substances. Benzos are notoriously hard to get off of because of the intense withdrawal symptoms, which can induce a fatal grand mal seizure. Common benzos include alprazolam, which is generic for Xanax, lorazepam, which is generic for Ativan, onazepan, which is generic for Klonopin, and diazepam, which is generic for Valium. Although it is very common for patients to be on these meds simultaneously with antidepressants, they are not usually considered augmentation. Buspirone, which is generic for Buspar, is a non-benzodiazepine anxiolytic that can be used as augmentation therapy. Buspar treats the symptoms of anxiety without the sedating and hypnotic effects associated with the benzos, which makes it a better match for patients also suffering with depression who are already suffering with low energy levels and do not need further sedation. Buspar doses range from 5 mg to around 60 mg. Stimulants such as Adderall, Vyvanse, or Ritalin can sometimes be used as an off-label augmentation when other means have failed. The energy boost and increase in concentration can help patients who are still dealing with low energy and brain fog that are common with depression. Another augmentation strategy that can be used is adding on a thyroid hormone. Our bodies naturally make thyroid hormone, which helps the body balance its metabolism. When the body is not producing enough thyroid hormone, the metabolism slows down and energy levels plummet, which can lead to weight gain. This is known as hypothyroidism. When the body is producing too much thyroid hormone, the metabolism speeds up and boosts energy, which can lead to excessive weight loss. This is known as hyperthyroidism. A doctor can prescribe thyroid hormone to help balance a person's natural levels. Levothyroxine, which is generic for Synthroid, is a thyroid hormone that is prescribed to treat hypothyroidism. Synthroid can help boost the metabolism and increase energy levels. When Synthroid is added on top of an antidepressant, it can help boost its efficacy because the body can metabolize the medication better, and the increase in energy can help mitigate some of the symptoms of depression. Many patients who are depressed also have thyroid issues, in which cases they may have thyroid hormone prescribed by an endocrinologist. But for the ones who don't, it is not as common for doctors to try and augment with thyroid hormone because it requires routine blood work as well as fine-tuning dosages to make sure the thyroid hormone is balanced properly. Lastly, we have L-methylfolate, which is a naturally occurring vitamin. A prescription-strength L-methylfolate supplement called Deplin can also be used as augmentation therapy. Many patients that suffer from depression are deficient in vitamin B and folic acid. By supplementing with Deplin, patients can increase their levels of L-methylfolate, which can help with energy levels and can naturally raise the levels of serotonin, which tend to be low in depressed patients. Although there are no side effects associated with Deplin, it usually doesn't pack as much of a punch as some of the other options previously mentioned. As we saw, there are a multitude of options to treat depression, and finding the right one is no easy task. Unfortunately, for some people, none of these options will work, which is why alternative treatments for depression, such as TMS, ECT, and esketamine, are becoming more commonplace today. The mental health industry is constantly evolving as we discover new things, and hopefully, these new discoveries lead to a better life for countless individuals.